And thank you very much for joining us here on PM Express. Of course, we are counting down to Christmas. Just 48 hours more, and then Saturday is Christmas. But guess what? There is COVID-19, which is proving to be an ultimate Xmas spoiler. But it is proving so because we have to avert another surge. So yes, let's have the conversation now. And you've heard it all day. The suggestions from the Ghana Health Service that we need to put restrictions in place for all the activities that you are planning to attend. So we are bringing in those organizers of these events to have this conversation tonight as we look forward to Christmas. This is the last PM Express before we all celebrate Christmas. And so it is important to usher you into it well informed. Now, the Ghana Medical Association in the last hour or two have issued a statement on the current situation, and they're talking about an escalation in COVID cases in the country as we speak currently. And they are very convinced that this upsurge in cases is most likely due to the Omicron variant. And what do we know about the Omicron variant? If you look at Bloomberg, they talk about the fact that it has at least double the risk of getting infected on a plane, for example. And I know many of you are going to be traveling across the world to watch this. And I know many of you watch this show from all over the world, or you may be planning to come to Ghana to celebrate. If you're on the plane, watch that. Now, after the 17th of December 2021, these are the numbers we have locally. The total number of cases stand at 133,000, and then we have deaths of 1,200. The active cases currently has gone up to 2,428, and severe cases is 24. This is being updated, and so we possibly will see a spike. Now, active cases, number of infected people, and I want you to look at these peaks here. We've had the first wave, second, third, and watch this here. It's beginning to climb up again. This is December 21, and this is according to the Ghana Health Service portal. And so you begin to see this climb here, and this here is what we need to watch, because if we don't do something about this, it's going to climb up, and we're going to have a situation like this. The good thing to note, though, is that the subsequent surges that we've had, the waves have all been lesser than the previous, but you don't want to get a wave. I think that's a key thing. And so we are here as of 21st December 2021, and you want to keep it there or bring it back down to its, somewhere around these areas. And that's why the Ghana Health Service is saying a lot about what you need to watch out. The Ghana Medical Association, in the wake of the picture I just showed you, they want health facilities that have, they are saying that health facilities, this is the doctors, they work in the facilities. They're telling us that the facilities have witnessed sharp increase in positive cases over the last 1 week. The doctors are saying, and you need to believe it. Don't joke with this. Don't say, oh, nobody's getting hurt by your inability to observe the protocols, especially in the Greater Accra and Ashanti regions, with alarming daily positivity rates ranging between 40 and 50%. So this is very serious. It's going up at a time, and I get it. This is the ultimate Xmas spoiler, but the WHO says it's better to cancel Christmas than to cancel a life. I know that's difficult to hear, but that's a reality. 9 things to take into consideration to avert a fourth wave. And this, according to the Ghana Medical Association. 1, COVID-19 pandemic still poses an existential challenge to the health of all persons living in the country. They make the point escalating has the potential of further weakening our health system, and non-adherence to the preventive measures, especially during this festive season, has the potential to further fuel a spread of the Omicron variant. They're asking authorities then to enforce the protocols, especially at event grounds. And that's where there's a lot of focus on these events. We're talking about parties, we're talking about nightclubs, churches, big indoor events. And there's a lot of focus on big indoor events because the risk of catching COVID is more likely when you're in an indoor place than when you're outdoor. And so there's a lot of focus there. And if you fail to do this, you're talking about possibly encountering a major fourth wave in January. Don't forget, January this year, we had a major wave. January, February, a lot of people died because we lost the ball. We dropped the ball in December for political reasons and for the campaign period. Also, the GMA says, vaccinate if you are above 15 years. That's key. Vaccinate. And the government should also ensure prompt, continuous, and adequate supply of distribution of PPEs to all health workers. They also want the scaling up of COVID-19 testing and contact tracing. I wonder if contact tracing is still something that is relevant with where we are currently with COVID, but that's GMA's proposal. They also want the Ghana Health Service, Ghana Ministry of Health, NCC must also really launch that initiative to educate Ghanaians, one, about the need to vaccinate and also to stay safe. And this is the part that I like. If assuming the Ghana Health Service, assuming the event organizers, assuming everybody else feel they are in their responsibilities, this is about you. It is your life. It is your life. Take it into your own hands. And that's the Ghana Medical Association's warning to you. Yes, we know it's the ultimate Xmas spoiler, but it's about life and death. We're going to talk about that. We have event organizer joining me, one of the major events. In fact, I must say it's one of my favorite events, very creative event this Xmas period. I will speak to those behind it. How are they going to manage this? It's pretty unique in Ghana. We haven't had that before. A big party in the bush somewhere that is being organized, but are they doing with how they're doing COVID? And then we'll talk to the health experts also. So stay with me. Yes, it may spoil your Christmas, but maybe these few tips you're about to learn may help you navigate the enjoyment, but also stay alive. Details after this. Well, joining me right now on Zoom is Sadiq Abu, who is very famous for his ability to pull off some of the best shows you can ever attend. He is a CEO of 3 Media Networks. Sadiq, thank you for joining me on PM Express.
Thank you guys for having me.
Are you in the bush yet?
Yes, I'm actually at the Shire Forest Reserve, where we're getting ready for what will perhaps become one of the biggest festivals to be curated in the world.
Okay, we'll talk about that shortly. Dr. Kwame Sapana-Seidu, who I must say may be envious of you. If he can escape the cold weather in London, he will possibly love to be here to join you at the Shire Hills Forest. Thank you, Doc. Grateful to have you. He's a pharmacist, research fellow at CDD Ghana. You are in London. I don't envy you at all. You should see the weather in Ghana. It's beautiful, Dr. Kwame Sapana-Seidu. And this is just to tease you a bit. The only time I don't want to be in your shoes is around this time. Thanks for joining me.
Never tempt fate. As I always tell my brothers like Dr. Dokosa, I'm a nomad. You can see me in London today and you see me in Accra tomorrow. So
no, you're not welcome in Ghana this time. Please enjoy your London.
Yeah, you never know with me what is going to happen by the way.
No. By the way, talking about that, Dr. Abuaji Dacosta, please make sure that the airport guys don't look out for him. If he tries to come, please just make sure the testing regime, for Kwame Sapana-Seidu is stricter than all of the others.
So I hear you.
Yes,
I hear you.
He's
not allowed in.
Yeah. He can't be allowed in. He stayed in London. He should just stay there to the rest of the winter is freezing him over. Yes. Yeah. Head of Health Promotion and Risk Communications, COVID-19 team is Dr. Abuaji Dacosta. I'm grateful, gentlemen, for joining me. Dr. Frank Srebo is the president of the Ghana Medical Association. He's also joining us on the phone. They issued a statement tonight on everything else. Hello, Dr. Srebo. Great that you could join me. Let me start with you, Sadiq. I can only start with you. How many people are you expecting at Wilderland?
Well, on each day, we're expecting about between 3,000 to 3,500 people. The total footfalls, we're looking to have over the 2-day period is about 7,000 people. Even though we've not hit that target yet, from the ticket that's moving, we are confident that in the last few days left for the Wonderland, we would have some few more people joining in. As it were, we know that we may probably have more numbers, but together with our health team, our health, security, safety team, and all of that, we made a decision to cut or to cap the numbers to a more sizable number that's manageable. So that's expectation in terms of the total footfalls for the event.
Okay, so that's huge numbers, and I wonder, as an event organizer, how much are you factoring in the COVID complication? In the last few days, we've heard from the Ghana Health Service, we are seeing a spike and more cases. How much is that factoring into all the preparations at Wonderland with all the thousands of people you're expecting?
Well, there's a whole lot that's going in. I mean, first and foremost, our health team is led by the Ridge Medical Center, with about 10 doctors on it, health assistants, and a number of them. This is quite a major festival. And so together with them, our security team, the Forest Recognition Division here, and everything, we'll be factoring it in. Proud to all of this, the Ghana Tourism Authority, which runs the Ghana Beyond the Return, took the lead in the directives and advice in terms of the necessary COVID protocols to ensure that our festivals or our events becomes, a safe zone for our attendants. In fact, today, I came back, I was in Accra for a meeting with the Ghana Tourism Authority, the advisor on health, I think the Ghana Health Service and some members of the COVID team, where they met a number of us putting together events this time around, where we discuss a number of the protocols and the frequently asked issues or frequent issues that keeps coming up. I think that from the meeting, all of us, just like the state and the health professionals, are all concerned. We've always been concerned, and like I've.
May have lost him there for obvious reasons. He's still in the forest, but he's touched on something. Hopefully, when we get him back, I'll get him to expand on that. And I want to bring in Dr. Abaji Da Costa on the point he was making there. Doc, he's just saying that the Ghana Health Service have today met event organizers. He himself was part of it. He sounds very positive about the outcome. Tell us more about this meeting.
Thank you, Evans, and good evening to your viewers. So as part of our stakeholder engagement programs, today we, together with the Ghana Tourism Authority and the Ministry of Tourism, we met with event organizers. And obviously, we are concerned about the rising cases. And we wanted to hear from them so that we also let them know our perspective. Then if there are guidance, we can guide them to how they can organize the events in terms of alternatives and others. So the meeting went very well. We discussed a number of issues ranging from the protocols, vaccination, and how the Ghana Health Service team will support the enforcement of such activities. But we still insisted that we want events to be organized outdoors. So after the meeting, myself and the team took a tour to one of the venues where we were not really, in a discussion, we didn't, for me, I didn't know what it was or where it was and the kind of things that they were saying. So we wanted to really look at it and see how best we could possibly help. So we went to the arena where obviously they will be having a concert in a tent, even though it's an outdoor. They have big doors where ventilation or air can come in. and they've reduced the numbers from the capacity is about 4,000, but we advised that they reduce it to about 1/3. So they accepted it. There will be a vaccination site. There will be all the protocols in place. There will be social distancing. So I think it went well, and we are guiding all event organizers in organizing their activities in safety. Yes. So
okay, that sounds like progress. So what it means is that the indoors, the large indoor events, the caveat is if they can reduce it to 1/3 of the size, right? Is that what you said? 1/3 of the size?
No. We still insist that it shouldn't be done indoor.
Okay.
But this place that I'm saying, it is outdoor.
Okay.
But I think the building is like, it's not a building, it's like a tent something.
So this might be the tent at the International Conference Center. Is that one? I think it's called the
yes.
Arena,
yes.
Vent Arena or something.
The arena.
Yeah.
And if you look at the ventilation and the others, I think that it is okay as long as they reduce the numbers, because they will be opening the doors. They have windows as well. The way it is really difficult, but I think we had to come to some compromise with them. So it's not all events, it's just for this specific event
okay.
that we have given that compromise for them to obviously go ahead, but with some strict guidance and protocols.
Okay. Sorry, Sadiq, I lost you earlier. Let me come back to you. You were also in this meeting. What were your major takeaways from there?
Well, I think that for most of us, we are at a difficult point now. Of course, the health and safety, well-being of our attendants is of utmost importance to all of us, as much as it is to the Ghana Health Service and the state. Most importantly as well, heavy investments have gone into this. I mean, and for some of these events, the impacts and even the increase in expenditures to the states and everything are all that's very important. So we found ourselves in a more difficult position, so to say. So we basically had to, continue to speak to the technical people to find ways around it. Fortunately for myself, for Chela, and some of the outdoor events, we fall in the category of outdoor events. And so, and obviously the ones that have a pass of a sort. But regardless, it was it was difficult for all of us to take, given the work, the impact, and the investment that has gone into it so far. But of course, most of us, I think, would rather the safety of the states and attendants are protected, even though we're in a very, very difficult position at this point. And so finding a common ground together with the technical people and relying on their technical expertise and advice regarding how we can manage this, following strictly the COVID protocols, demanding all the COVID vaccination cards and all of those things is but a surest way to go to ensuring that we still have fun this December. We are able to most likely recoup on our investments and duly pay our taxes to the state, and then obviously also protect citizens in the best ways possible.
Yeah, and let me bring in Dr. Kwame Sapon-Asiedu. Kwame, so you've had Dr. Da Costa, who says they had to reach a compromise. You've had the compromises on the back of this meeting today. What's your comment on those?
Thanks, Evans. I'll go to the Ghana Health Services only. And I'll start from the 12th of December, where active cases were 973. Then, a few days later, when the Director General held his press conference, where he was a bit concerned, which was on the 16th, it was 1,301. That was about a 400, 500 increase in active cases. You have to realize active cases is a balance between recoveries and new cases. So you must realize that the new cases over the period were much larger. Then today, I was on your station with Dr. Patrick Kumar Abwaji, who said active cases are just about 3,000.
Yeah.
Yeah.
And today is the 22nd. So he was talking about data from the 21st, because obviously it was first thing in the morning when I was engaging with it. So you see the trajectory. And then I look at the data from the point that globally, the Omicron variant has a doubling rate of 2 days, maximum. In fact, in some countries, it's 1.3 days, but maximum, we're saying 2 days. And I asked myself, that is without all activity. There's no activity going on. Yes, there have been a few, 1 or 2 pre-Christmas activities, but currently we've not hit the peak. And we have had a doubling from the 12th, which was 973. You expect twice that to be about 1,900. You expect twice of 1,900 to be what? 3,800. We've had a doubling to a point where we are over 3,000 now. And I ask myself, when we kick in with these activities, what is the projectile going to look like? And I have listened to Dr. Da Costa and I've listened to Sadiq. And none of them has so far convinced me that the trajectory would be altered. Because as it stands, all they are doing and talking to me and you and listeners about is mitigation. To mitigate against further exponential growth. There's nothing I've heard about deterioration. And deterioration involves sometimes evasive action. And what do I mean by evasive action? Like you said in your preamble, that's what the Director General of the WHO said. You can postpone an activity at Christmas, but you cannot postpone a mortality. I also hear, Sadiq, that as taxpayers, and in a country where our economy is constrained based on COVID for close to 2 years, activities like this will generate revenue, they will recoup their investments and pay their taxes to the country that is struggling for funds for transformational development. So you put these 3 segments together and you ask, where do you draw the line? And for me, this is where you draw the line. If I was in decision-making position, I would have used a triple lock. And what do I mean by that? Currently, the Ghana Health Service has, the Food and Drugs Authority has licensed antigen tests. There are vaccinations available to check who is fully vaccinated and who is not. The Ghana Health Service has told us that they are going to put mandates in place whereby if you are not fully vaccinated, you cannot access certain facilities. But that is not coming into force for a few weeks. I would have said, for you to access any of the activities like Sadiq is organizing, you should have an antigen test, a rapid test, because that is, currently there are even new ones that have come that are 15 minutes. You can do that at the point where they board the buses to go to the Shai forest and all that. So if people are minded to access such activities like Sadiq is organizing, I want to believe they'll be minded to take cognizance of their health and safety and the health and safety of all parallel humans who come into contact with them. And I use parallel humans because at the moment we're dealing with a pandemic where it's not just about your health. This is Christmas. You might go for this activity, you probably get infected. You have a strong immune system, you are younger. You might go and visit your elderly parents, you might infect them, and unfortunately, they may pass away. That might be a burden on your conscience. So why don't we say you have an antigen test before you enter, you're fully vaccinated, and when you leave, you have an antigen test too. That for me is a triple lock, and that's mitigation. And that is containment. And so if I was in decision-making position, this is how I would go.
Okay,
in order not to constrain the likes of Sadiq, and in order not to put the Ghana Health Service in bad light.
Okay. I mean, very interesting points. I want to bring in Dr. Frank Sirbo, who is the president of the Ghana Medical Association, into this conversation. Doc, do I have you on the line?
Yes.
Okay, great. Your members are on the ground in the hospitals. What are you seeing in the hospitals as far as COVID is concerned in the last few days?
Thank you very much. Let me say greetings to Dr. Kwame Esedu. It's been a long time since he called me. So I'm sure London.
You went to the US. That's my mitigation.
London is treating him well, so he's forgotten that I'm here.
Yeah, he has. He's forgotten about all of us. That's why we don't want him to come back.
Yes, I can imagine. Evans, truth of the matter is that we are having a lot of cases in the hospitals at the moment. We have some of our doctors who are testing positive. A lot of the nurses are testing positive. Indeed, there are some wards in some hospitals that are basically now being run by other people from other wards, meaning that all the people in those wards have tested positive and they are supposed to go home. As I speak to you, I am in a very small facility, but I can tell you that 3 of my doctors, we are only 7 doctors, 3 of us have already tested positive. And it's not like they are just asymptomatic, they are symptomatic, and so I have to let them go home.
Are you yourself, does it include you?
Unfortunately, I have not tested because I have not had any symptoms, but they have symptoms as of yesterday.
Okay.
And so we did a test, and as of now, 3 of them are supposed to go home, and they are home, meaning that out of the 7, we have only 4 doctors available to do the work of the 7 people for probably the next 1 week or 2 weeks. And until recently, even our COVID center had been virtually empty. We are beginning to see cases. So the situation in the hospital is not that good. Our colleagues in the testing sites are reporting that now when samples come in, you can predict that about 60 to 80% of the samples will test positive. And so clearly, the situation is not helping. And if you look at the statistics that Kwame Esedu gave you, until recently, just about less than 2 weeks ago, we had less than 1,000 active cases in Ghana. And as of this evening that we are talking, we have more than 3,000 cases in Ghana at the moment. And I'm sure by tomorrow, we will probably have more cases being reported as active cases. And so the situation is not too good. I think it's quite scary, especially so when we have enjoyed a longer or a lengthy period where we had basically very few cases, and all of us thought that that was probably we were seeing the end of COVID-19 in Ghana. But unfortunately, I can't report same as of this evening. The situation is not good at all in the various hospitals. The reports we are getting is quite scary.
What does the GMA want to see happen? I mean, this is Christmas. Investments have been made into programs, etc. There's a compromise, right, that we need to reach. Kwame Sapon-Sidu's compromise is that let the antigen tests happen before the event. The Ghana Health Service has held a meeting with the event organizers today. Numbers are being looked at in terms of, one particular indoor, but also enforcing the COVID protocols and working. What does GMA want to see as far as these events are concerned?
I think we are better off being able to be part of these programs and regulating the programs. Okay. That is the best way to go. So for me, I am happy that Ghana Health Service has gotten involved to ensure that at least they are meeting event organizers and they are able to be part of their programs and make sure that they are able to regulate and restrict. But just like Kwame said, we can add another layer to it, and that is to do with the antigen testing and, of course, be able to let people prove that indeed they have had their vaccines. After all, That is what Ghana Health Service is advocating for. That for events of such nature, before you go in, you should prove that you are vaccinated, and indeed, with an ID card, not just the vaccination card, because vaccination cards alone does not mean that there is the same person you are looking at. So we need to make sure that those individuals come with national identification cards, and we are able to match the vaccination cards with their ID cards. And beyond that, at least do the antigen test. And after all, when you are coming into the country and you get to the airport, regardless of the number of people who are masked up at the airport, you still have to have an antigen test done, and then your results are declared before you are allowed to enter into the country. And so here, if you choose to go for any program, then you should be ready that when you are going, definitely all the protocols would apply. You have an antigen test done, and you have to prove that you are vaccinated. And once we are able to do that, I believe that it will be more of a double protection for all of us. And I am happy, very happy that Ghana Health Service is getting involved in the events, because if you don't get involved, what you have to do is that then you have to go the brutal way, engaging the security agencies to go and enforce that people are following the right rules and regulations. That is very difficult.
Yeah.
But once you engage them and you are able to regulate it, you are part of the system, and then all of us are advocating at least some level of protection that we can put in place, and add to that the antigen test and, of course, the vaccination. I believe that will be very great and will be very helpful. And especially, we should then treat people to also have outdoor events instead of indoor events.
Yeah.
Because it is known that a lot of the cases, the spread is when we have indoor events without proper social distancing. If it's outdoor events that we can regulate, we can be there, and we can make sure that the right things are done. I believe that is the best move that we can have as a country.
And Sadiq's event is an outdoor event, and so it's one of those that...
So let's add a layer to it. Let's test people, let them prove that they are vaccinated, and then they can freely come, rightly spaced, and they can have their enjoyment. And you remember Kwame said something that is very important. When COVID did strike Ghana, we have to undergo a lockdown. I think our lockdown was some few days.
Yeah.
And as of today, we are still referring to COVID as the reason why our economy is suffering.
Yeah.
So we have to look at the two issues and make sure that, yes, people have had investments in these events, but how can we help them ensure that at the end of the events, we don't go back and all the money they have made will be chopped up by the economy getting bad because of COVID again. So let's look at it.
Let me bring in Sadiq. Sadiq, obviously, I mean, your program is outdoors, and so,
yes.
I mean, it's that the risk is lower than the indoors. But let me ask you about, from an event organizer's point of view, can you afford to add that extra layer that we've just heard from the experts of people coming, checking whether they're vaccinated, and also encouraging PCR test results before they come in? Can you afford that?
Yes, I mean, in our case...
Oh, goodness me. Hopefully the line will work so we can hear him on that, because this is absolutely key. We lost him there.
Hello?
Yes, I can hear you. I can hear you. I can hear you. You can go on. Yes.
I'm saying that in our case, in fact, that's one of the things that our health in the Regional Medical Center did prescribe. And so part of the courses that we did was to bring in some of the antigen test kits here. They've got a lot of it here as well. In fact, as we set up, part of the 5 members of the team are here already. Again, they advise per their advice. We're looking to have about 4 different health outposts here and all of that, and following all the COVID protocols. As it stands now, I mean, it's the best. I mean,
Oh, unfortunately. I'll bring him back, hopefully, because he can. I want to really hear that. If that's what you're doing, that's really commendable. Yes, go on, please.
Yeah.
You're talking about...
as it stands, as it stands now, I mean, I think that it will be the best thing to do, having the antigen test, even if we cannot do it for everybody else, demanding for the vaccination cards as well, and then following the well-established COVID protocols that we've been following for events in the last few months. And that...
Oh, goodness me. Let's see if we can get Dr. Baji Da Costa in very quickly as he gets his link back up. Dr. Da Costa, I want your comment on the suggestion from both Dr. Frank Siriboy and Dr. Kwame Sapasiu, that we should add an extra layer into the conversations we've already had with event organizers. What's your take on that?
Okay, thank you so much, Evans. I think, let me put it into perspective that I think it came up at the meeting, but these are things that we've been doing. For example, if you look at the Youth Connect, we deployed the Greater Accra Regional Team, and they did the antigen test. So, and we told the event organizers that the conversations will continue, is ongoing. So any suggestions that we believe that it will avert any possible surge or any increase in cases, we will let them know. It's a good idea, and we will take it on board to engage further. I mean, I'll be speaking to my Director General and the whole team to see how best we can assist them with the antigen test. But we've done it in the past, and I don't think there is any problem for us to do that.
Okay, great. So what it means is that your team will be coordinating with the grant organizers to help them roll out the antigen tests.
Yes, I mean, that decision should be taken by, obviously, the Director General, the task force.
Okay.
So, because we had a meeting with the event organizers, but it came out, like Sadid was saying, Sadid actually made it clear at the meeting that they are going to do the antigen test. And we said, okay, that's fine. But we recommended that if they could check the vaccination cards, that could be helpful. But I think on a second thought, what Kwame and Dr. Siriboy are saying are good. So we could have a look and say, because we've done it in the past, I think considering this will be easy so that we support them in rolling out the antigen test in addition to the other protocols and the vaccination. So we said conversations are ongoing, will continue. So we will certainly link up with them and give them feedback on how we plan to obviously support them with the antigen test if necessary.
Sadiq, let me bring you back in if you're there, because
yes,
the measures you rolled out are very impressive, very elaborate.
Yes.
How much extra is this costing you to do this? And because you've done shows in the past, post-COVID, before COVID, and now, I'm pretty sure this will be hitting your bottom line pretty hard.
Yes.
From an event organizer's point of view.
Yes, in fact, it is. I mean, having a whole medical center and their team of health professionals join you on the event, obviously, is expensive enough. And then now we are having to double up on even the COVID protocols. So in our case, because we're doing free, luxurious bus rides from the Accra Mall, our COVID protocols or COVID activities starts from the Accra Mall. Then when you get here, you come to the first gate of the first the reserve. There's another COVID protocol you need to go through. And this explains why, again, from the, the doctor's advice, we're having to discourage a lot more people from having to drive into the reserve so that we can, within the buses, we can get them to follow a certain COVID protocol within the buses. But even before that, they'll have to go through the process and everything. It's a well-elaborate process. And so it would definitely, that's cost us also because you're looking to create a festival that will match a certain international standard. There are standards to, international festivals of this nature regarding crowd control, health, safety, outposts, all of those things. And so it's non-negotiable that we have to do that, first and foremost. And then obviously, given the situation that we face currently, it's become even much more important to have to go there. And so we didn't have an option to do that, to ensure that the health and safety of all the people that come to the events are duly protected.
I mean, Dr. Sapasiu, this is definitely an event you would love to attend if you were in Ghana, true of us. I mean, if you listening to the elaborate nature of the protocols that had been putting, I wonder your thoughts on that.
Well, yeah, let me start from the back. Yes, as a Katangi, I would attend any program that is in the bushes because I like it. So that I would never run away from that. Anyone who knows me knows that naturally I'm gregarious. But a bit of advice I'll give to Siddiq. It's great that you've got the antigen tests, But one thing you have to look at is that these tests, especially with Omicron, because the data that's coming out points to the fact that the incubation period between infection and ability to detect it has shrunk from 72 hours to less than 24 hours. And so if you look, the US has now changed even their PCR test to say you have to have a 24-hour test. Ghana has maintained their 72 hours for the right reason, because they have an antigen test at the airport, which then can pick if you have escaped the first 72 hours. So that makes sense. But in your case, where you are organizing a luxurious ride, you would be better off having the test at the point where they board the coaches than having it in the reserve. Because if people test positive where they are boarding the coaches, you can exclude them. And you are not bringing an infection into your event center, the call center. Compared with if they come there and then you have a logistical challenge trying to exclude them because you've got to get them out of the premise. So now that you have the equipment, great. But my advice would be situated out of your main event rather than within the premises. Alternatively, you can have it both ways, have it out of the event where they are tested and have some within the event just in case people start becoming symptomatic, so you can exclude them relatively quickly. Someone is feeling unwell, you can quickly test them. If you do that and you check the, vaccination status, I think you'd have a robust protocol in place. And in that case, if anything happens, it wouldn't be for want of trying. And so that is the advice I'd want to give Evans.
Sadiq, quick thoughts on that, and I'll take a quick break.
I mean, it's very good. It's well intended. It's a very good advice that we have to follow to ensure that we don't have a surge. So this is something that's good. I would pass it on to the lead doctor on the team. I would ask some few more questions. Yeah, usually the technical people that direct us. I'll ask some few more questions and see what they can do as well regarding this advice. But I think it's a very good one.
Fantastic. I'm going to take a break. When I return, we'll talk about. So Sadiq is possibly you want to make the Sadiqs and the Wilderlands the norm during this Christmas and New Year festivities. And so the question becomes, how do you monitor for those who want to break the protocols? It's what is the monitoring mechanisms to ensure that other events are following these same protocols? If this is an outdoor event and they are rolling out all these measures, the indoor ones, the advice is that don't do it. But I'm curious about monitoring to ensure that the protocols are being observed. When I return, I'll speak to the Dr. Boaji Da Costa about it and get the thoughts of Dr. Frank Sirbo also about how to monitor and make sure everybody else is doing the right thing to keep us all safe. Stay with me. So live on PM Express. COVID-19, is it the ultimate Xmas spoiler? Well, as it's turning out on the show, you can still have fun and still, avoid dying or getting COVID-19 if you follow the measures you've had on the show. I want to bring in Dr. Boaji Da Costa very quickly. Doc, so there are good event organizers and those who want to cut corners. We all know that in every society. What's the monitoring mechanism during this Christmas and New Year to enforce these protocols? Hi, Dr. Boaji Da Costa, if you can unmute for me. Oh, he's frozen. Okay, Dr. Frank Sirbo, what sort of monitoring mechanisms you want to see in place from the Ghana Medical Association?
Evans, I believe that there is no better monitoring mechanisms by being able to educate people, let them understand the implications of what they will be doing and the benefits that they will get if they adhere to all the protocols. And if you looked at the statement of the Ghana Medical Association, we specifically indicated that individuals should take their lives into their own hands and ensure that they themselves be the first people to protect themselves. However, in cases where it is so obvious that it's there for everyone to see that they are breaking the protocols, I think in the past, the security agencies have done a very good job by making sure that at least those who lead the organization of such programs are arrested and prosecuted. And we believe that similar things should be done at this moment. But regardless of all of this enforcement, we believe the best thing for us to do is to let people understand that they stand to benefit more by following the protocols, ensuring that if they have an event to be organized, they should contact the Ghana Health Service, let them be helped, so that at the end of the day, they can organize a very beautiful program, which at the end of the day, we would say that it didn't contribute to whatever surgery we may have or we may not have in the country. So I think we need to encourage people. We need to educate. We need to continue doing this. At least we know that already we are in the Christmas period and the New Year festivities will start very soon. But we should be able to engage people, especially the churches.
Yeah, very important. Let me quickly, because of time, let me quickly bring in Dr. Da Costa. In 30 seconds, Doc, what monitoring mechanism should we expect? Hello, Doc. Oh, Dr. Da Costa? Okay, he's frozen again. Let me bring in Sadiq. Sadiq, let's go to your program. Who is on the bill? Who is on the bill? Because I want to end the show with one of your big acts performing for our audience. Who is on the bill at the Wilderland?
All right, so on day one, it's day one is being headlined by Shatawale Sarkodie R2Bs. On day two, Davido, Adenkule, Stonebwoy, CK, and a number of other talents are headlining day two. So that's what it is. But in terms of the itinerary on the lineup, day one is where we do the welcoming in for everybody, and those, particularly those that have are taking the 10 packages. And then day two is in the morning. There's a number of activities: hiking, abseiling, wild rides, checking out, looking at some of the animals and everything. And then from 5 p.m. the performances start till late, and then we depart from there. But quickly, Evans, just to say a shout out, our lead doctor, Dr. Kranti, just walked in here. He's leading the team that have been the Rich Medical Center team that have been putting into place all our health, safety protocols to ensure that we don't contribute to any surge from this event. I just wanted to say hi.
Hello, Doc.
Hi.
Hello, Doc.
Hello.
Great, and thanks for the good job you're doing. And I hope he's paying you well.
We talk about that backstage.
That's a good one. By the way, did you say Sarkodie is on the bill too?
Yes, Sarkodie Shatawale artists are headlining day one, and Davido, Stonebwoy, Adenkule are headlining day two.
Great. I want to end with one of my favorite Sarkodie songs. I don't know which song Dr. Kwame Sapashiru likes or dances to. But I will impose this on him and all my guests. Merry Christmas, and thank you all for joining me for PM Express, the last show before Christmas. I want to end with Sarkodie performing. You want to go to Wilderland and enjoy him perform in flesh. Enjoy the rest of your evening.